Hi, I'm Dr. Rhonda Lowe, and welcome to Your Medical Pipeline. In this segment, we're going to talk about healthy travel. It doesn't matter if you're going to an exotic location like Africa or to a resort in Mexico. Hygiene standards in food and water may be contaminated, so it's important to be prepared when you travel, and that includes getting vaccinated against certain diseases. When the winter blues hits us here in the Northern Hemisphere, many of us want to take off to sunny destinations. But surveys suggest that travelers significantly underestimate the health risks of traveling to places like Mexico and the Caribbean, and they're not taking proper precautions. It's recommended that you get a hepatitis A and B shot if you're heading to less developed countries, including Mexico. For example, if you go swimming, hepatitis A virus can survive in water for up to 10 months. And going to a barber or getting a pedicure can put you at risk for hepatitis B if unsterile or contaminated instruments are used. So it's important to be aware and take precautions. And no matter where you go, every 10 years you should get boosted for your routine vaccines like tetanus, diphtheria, and polio. But the most common problem travelers encounter is diarrhea. It's estimated that 50 to 60% of travelers in a 2-week holiday will have a bout of traveler's diarrhea. Watching what you eat and drink is the best way to prevent getting sick. Some guidelines include making sure your food is adequately cooked and not left to stand for hours. Ice cubes and things that have been washed like salads can be risky, and don't eat anything that you haven't peeled yourself. And no, I hear this all the time, drinking alcohol does not kill those germs. If you do suffer a bout of diarrhea, it's important to rehydrate with flat ginger ale or 7-Up or dehydration salts that are in boiled water. Children who get diarrhea can dehydrate very quickly, so it's important to make sure they get enough liquids. Mothers who are nursing need to take extra care to prevent dehydration to make enough breast milk to feed their babies. To try to prevent the so-called Montezuma's revenge, there's also an oral vaccine called Dukoral. That gives some extra protection against travelers' diarrhea. It protects against E. coli, which is the most common organism out there causing travelers' diarrhea. Ideally, you should visit your family doctor or travel clinic 4 to 6 weeks before you go to give enough time to get any vaccinations or medications that you need. In this case, really, a little prevention is really worth it, so you don't miss out on your vacation. My comments are for information only and should not be used to replace a visit or the advice of your physician or other healthcare providers.